Understanding morning erections and their importance. If you've noticed that your morning erections, also called morning wood, have disappeared or become less frequent, you're not alone. This change could be telling you something important about your overall health. Morning erections are a natural part of male physiology. They typically occur during REM sleep cycles and are a good indicator that your body is functioning properly. For most men, especially under age 60, waking up with an erection a few times per week is considered normal. But when these erections stop happening altogether, it can signal underlying issues. One common reason for the absence of morning erections is poor circulation. Erections rely heavily on strong, consistent blood flow. Hormonal health is also crucial. Testosterone levels naturally decline with age, especially after 40, affecting libido and spontaneous erections. Sleep is essential. Morning erections happen during REM sleep cycles, so poor sleep can affect their occurrence. Stress and anxiety can disrupt hormone balance and reduce erection quality. Managing stress is vital. Certain medications may also affect morning erections. Speak to your doctor if you notice changes after starting new medication. To improve your sexual health, prioritize regular exercise and a healthy diet. Get enough quality sleep, manage stress, and don't hesitate to seek professional help.